uh, distinguished chairmen, distinguished delegates, distinguished colleagues, ladies and gentlemen. First of all, I would like to thank to Professor Musayev and Dilnoza for inviting me to give this very honorable speech on this very important meeting. So my task is HCV elimination in Turkey. So just first of all, I would like to just give brief challenges of the eliminating HCV infection. Why do we have to eliminate HCV infection? Because globally more than 1,095 people die from HCV every day. And also 400,000 people die every day, every year from HCV-related liver diseases. Even though HCV is a curable with the available all direct-acting antivirals. So it has been estimated that almost 4.2 million adults affected by HCV infection in 31 EU economic areas countries, as many as 580,000 are migrants. It has been estimated also 425,000 people affected with HCV infection in Turkey. So the majority of the people infected with chronic hepatitis C virus in European Union and Turkey remain undiagnosed and untreated, while migration has become a challenge. So hepatitis C elimination is feasible and will result in a cost saving. So this study was done by United States. Almost 3.5 million people were diagnosed as a HCV infection, and just 50% diagnosis of the HCV infection, and 16% of the patients prescribed HCV treatment, and only 9 patients achieved a cure. So similar results was gathered in Turkey too. 271,000 people with viral infections expected, and just 58,400 people were diagnosed. 10,200 patients were treated with DAA, and only 3.69% of the patients getting cured. In May 2016, the World Health Assembly endorsed the global health sector strategy on viral hepatitis 2026 and 21. The GHSS calls for elimination of viral hepatitis as a public health threat by 2030, reducing new infections by 90% and mortality 65%. The report focuses on hepatitis B and C, which are responsible for 96% of all hepatitis mortality. So the World Health Organization targets for HCV elimination at 2 time points, 2020 and 2030. So incidence targets 30% reduction in new HCV infections by 2020, 80% reduction in new HCV infections by 2030. So mortality targets 10% reduction in mortality by 2020 and 65% reduction in mortality by 2030. Harm reduction, increase in sterile needle and syringes provided by a person who injects drugs per year from 20 in 2015 to 200 by 2020 and 300 by 2030. Testing targets almost 90% of the people aware of HCV infection by 2030, and treatment targets 80% of people treated by 2030. So I would like to give a definition, micro and micro elimination, because micro elimination encompasses an entire country or region and reflects a national scale of achievements. Microelimination focuses on specific groups, such as people who inject drugs, incarcerated individuals, or certain geographic areas, such as step towards broader elimination goals. So challenges in achieving microelimination: insufficient funding for health programs, limited access, diagnosis, and treatment resources, stigma, lack of awareness about HCV, barrier in reaching high risk and the underserved populations. Microelimination for HCV, some advantages comparing total eradication strategies: targeting high-risk groups, screening and diagnosis, access to treatment and collaboration, sustainability and monitoring, public health initiatives, tailored national plans. So what do we need to achieve 2030 elimination targets? We have to do financing of national elimination program, implementation of harm reduction programs, expand capacity beyond specialists, remove treatment restrictions, implement monitoring and evaluation, implement awareness of national screening programs, and implement national linkage to care program. The patients who had high risk for HCV infections in Turkey, the patients who had liver disease, intravenous drug users, prisoners, the patients who had history of transplantation, the patients who have hemodialysis, the patients who have HIV infection, endemic cities, Hatay and Nevşehir, the patients who are older than 60 and had a history of had used blood products before years 2000, because that time the blood donors were not checking by HCV infection and HBV infection. So HCV prevalence in patients with intravenous drug users was already calculated almost 45% in male and 35% in female. The prevalence of hepatitis B and C among prisoners in Kahramanmaraş. This study was done 266 prisoners. So already estimated anti-HCV persons was 17.7%, and almost 49% of those patients had an anti-HCV RNA. Among the HCV prevalence in patients who have a hemodialysis, almost 4.5% was detected. Prevalence of HCV infection in pregnant, 0.2% detected. HCV prevalence in blood donors from 2007 to 2017 already year by year decreased, and just 10,001%, the last ratio. So Turkey viral hepatitis prevention and control program was performed between 2018 to 2023. So Turkiye viral hepatitis prevention and control program was implemented. Program came into effect on September 12, 2018, and has been communicated to all healthcare institutions, organizations, as well as program stakeholders. The objectives of the program are as follows: using appropriate public health approaches to reduce disease complications and death caused by viral hepatitis, to improve the care of viral hepatitis patients, to mitigate the socioeconomic impact of viral hepatitis in community settings. So these are the strategic actions the program outlines in the following strategies: increasing awareness, expanding immunization, strengthening surveillance, and improving access to treatment. Additionally, preventing mother-to-child transmission, ensuring safe blood products, preventing transmission among people who inject drugs, preventing healthcare-associated hepatitis. Implementation of harm reduction strategies to prevent new infections was performed, needle exchange programs, safe blood transfusion practices, education about transmission risk, vaccination of hepatitis E, A, and B, screening and early diagnosis, scaling up screening efforts to identify HCV infection early, especially in high-risk population, and linking them to care. Reduce mortality and morbidity associated with HCV-related complications, such as liver cirrhosis and hepatocellular carcinoma. Some of activities regarding the elimination of HCV in progress in Turkey now. So a lot of banner and leaflet-related viral hepatitis were pressed and were distributed nationwide. The educational videos were prepared regarding viral hepatitis and were distributed on televisions and educational programs. Family doctors were educated about the viral hepatitis, blood checking for viral hepatitis in the people who are candidates to a new marriage and the pregnant woman to protect. Screening, increasing the diagnostic rate of HCV infection, and also to increase types of on-site survey program. One bus, mobile bus, which has well-developed laboratory, visits Turkey from from west to east, from 2009 to 2010. Then in that study, prevalence of HCV infection generally was 0.4%. Connection with the treatment, integration between family health center and specialist treatment, integration between health center and prisoner, integration between AMETM, alcohol and substance addiction treatment center and health system, adding of HCV diagnosis on electronic medical record system. Reaching the well-qualified doctors, the role of family doctors as an observer, the number of doctors who can prescribe direct antiviral agents, richness to treatment for the patients with achieve HCV infection. So reaching the drug also contents of HCV treatment and special finance, agreement reimbursement, richness to direct antiviral drugs for all patients. According to Turkey Viral Hepatitis Prevention and Control Program, 3 scenarios were planned, the same as world scenarios. In the base 2017, almost 271,000 people, viremic infections just begin to check, and then treated 10,200 persons and cured only 69%. So in the increased program, 11,000 persons were diagnosed and treated 99%. And the WHO targets, again, 16,000 persons were diagnosed and treated, and the treated success SVR 99%. So total infected cases, liver-related death, prevalent HCC, and prevalent decompensated cirrhosis in Turkey. By 2030, the total number of viremic infections would decline by 35%. Number of decompensated liver cirrhosis and hepatocellular carcinoma cases would decrease by 10 to 25% by the same year. As you see here, all green lines, according to WHO targets, will decrease, of course, total infected cases, liver-related death, HCC, and also decompensated cirrhosis in Turkey. So, Mr. Chairman, ladies and gentlemen, as a conclusion, HCV infection can be treated with higher cure rates, and the treatment is cost-effective to reach the World Health Organization targets. Every country should spend more effort to early diagnosis and early treatment of HCV infection. Thank you very much for your patience.